So we're talking about moisturizers today. Dr. Shah. I'm here with Ranen and Sara. And first, before we get into moisturizers, we'll talk about the science of moisturizers. And the way moisturizers work is they try to prevent transepidermal water loss, which is abbreviated with TEWL or TWELS. And there's a couple of ways it can work. One way they work is by making an occlusive barrier, preventing water from escaping the skin. And this is something like Vaseline. The problem with wearing Vaseline, it's probably not the most attractive thing to walk outside with a big coat of Vaseline on. It does work, and it will be effective in preventing that from happening. A lot of the moisturizers will have a little bit of that in the fact of it. The other ways they work is in the form of a humectant, which is basically to attract moisture to the skin and keep it there. And this is in the form of something like a ceramide. And these are a natural waxy material, natural molecule that will help keep moisture and actually attract moisture into the skin. And then the other way they work is something called emollients. And so emollients work a little bit below the skin, and these are going to again provide protect the outer layer from internal water escape. So the newer moisturizers are kind of exciting, have hyaluronic acid in them. And so for those of you familiar with hyaluronic acid, it's found in such products as Juvederm, Restylane, and it's a natural occurring gel that's found in the skin. And what this does is, again, it attracts water into the skin, which will actually plump up the skin and have that effect. So, Ranen, what are your thoughts on moisturizers? Best way to use them? How to use them?
I love wearing moisturizer. I can't go without it. So I usually do every morning and night. I use a moisturizer. I put it on after a growth factor, my eye cream, and then I apply my moisturizer on. I usually like the moisturizers with or without an SPF. It just depends on the day, or if it's nighttime, I don't really care for an SPF, so I'll use just a plain night cream. But moisturizer is nice for me, especially in the wintertime. I feel like I can get dry easily, and I just love that feeling of softer skin.
Well, for me, I'm an acne patient, so I have a little bit of like cystic acne, hormonal acne, and just like pustules, which is I have acneic skin. So I take care of my skin with like peels, and the way I keep my skin moisturized, because I create so much oil, I want something more like what Dr. Shah was talking about, is like a peptide gel that attracts the moisture and keeps the moisture in my skin, but doesn't give me that like slick feeling that like a moisturizer would. So definitely, if you're acne prone, have oily skin, you don't want to add extra oil to your skin, so I would definitely recommend the hydropeptide gel, which is with the hyaluronic acid, so it's plumping my skin and hydrating it at the same time. And it's going to be non-comedogenic, which is does not cause acne, so that's why I like that one.
And do you think some of the moisturizers cause acne because of their occlusive effect, which is blocking blocking the pores and that
For
effect?
sure, yeah. I've tried to use moisturizers because, like Ranen said, like I love the way they feel, like on my hands. Like when I put it on my hand, it feels great, and I like the way they smell. And I know it's so beneficial to wear a moisturizer, but as soon as I put it on, I will put it in one area only just to test it out, and sure enough, it'll occlude my skin, occlude my pores. So definitely not good for me, a moisturizer.
And so, so what you're talking about, and this is one of our products, if you want to talk a little bit about, this is Aqua Profundo, and so this has peptides and hyaluronic acid based.
Yeah, so this is such a great moisture enhancer. I always like to test it out on my patients. I'm going to put on Dr. Shah first. So I will do like a little drop, and you can see how it's just sits on the skin. Put that into the skin, and instantly you see how it causes, it like makes the skin look and feel like, I always call it like juicy. Looks like really plump, like instantly. And not only that, it like brightens everything up really nice. So I put this on first, and then I go to Dr. Shah's medical BB cream, which is right over here. Put that on the skin. So this would be like your one and done. This is the step that I do in the morning. Put my peptide gel, and I'm protected from the sun. I also just created like a nice primer to put my makeup on with. So, I mean, I wish you could feel his skin. It's not only brighter as compared to this hand, you can see, so it just feels really nice on, and it's not gonna occlude my skin. So this is like my one and done in the morning, and I feel really good as I'm like coming into work that I'm protecting my skin from collagen loss with the sun damage, and also just like the scars that I do have on my skin from acne, I'm not making them darker because of the SPF. So this is like a really good combination that I always recommend to patients. As soon as I put that on their skin, they're like, I want it. It's really.
And so it's a use kind of a modern BB cream, which is our Defensa El Viso, combining with an Aqua Profundo, which has kind of the two technologies working together. What about during the winter? Any tips for patients for dry skin? You know, we're talking about moisturizer, but just tips in general to keep your skin hydrated and plump.
Sure, I personally like, especially during the winter time, it's an excellent time to get like chemical peels and stuff like that to kind of get rid of what can cause dryness and irritation and stuff like that on a patient's face or skin. So I actually...
And do you think that the exfoliation you're getting from that, the turnover of new skin?
Yeah, absolutely.
So you definitely want to stay hydrated. Everything works from the inside out. That's what I always tell patients. What you're doing on the inside is going to reflect on your skin. So if you're dry on the outside, you're most likely dry on the inside. So drink lots of water with the air, with the heat and everything. It is dehydrating to your skin. So drink lots of water and add things topically to avoid the transepidermal water loss, which is TOOL. Keep your skin hydrated that way, is from the inside out. Probably what I always tell my patients is the best way to ensure that you're hydrated.
Okay, and I think the other way, I think that's kind of a novel way of providing hydration to the skin, is trying to use your own body's sebum and to generate the oil, and which will kind of protect your skin. And that can actually come from growth factors. So a lot of times during the winter, patients might dial their retinols down a notch or two, which can dry their skin out a bit, and still keep it going, but maybe dial it down a notch, and maybe instead of doing every day, go to every other day or every third day. And then using a growth factor, what you're going to do is you're going to stimulate your body to make more sebum and make more oil. It's going to make your forest of your skin more lush. And by having a lusher skin, you're less likely to get dry skin, because your skin's going to be much more able to handle it than you can when it's thinner. So different ways of attacking dry skin, I think, especially during the winter time. And I think using a science behind it to treat it is going to be a much more effective way than just slapping on Aquaphor or Vaseline over your face. Probably more attractive too, I think.